Namaskar everyone. Today we are going to study about autopsy pathology. So what is meant by autopsy? Autopsy is done mainly to know the cause of death. There are two types of autopsies. First one is medical legal autopsy and second one is pathological autopsy. Medical legal autopsy is done in various medical legal cases like road traffic accident, suicide, homicide, or cases of poisoning, etc. And it is done on the requisition of uh, policies or any legal authority, and we have to do. And relatives' consent is not compulsory in autopsy, in medical legal autopsy, when there is a necessary or there is suspected of some homicide, suicide, or any suspicious activity. And medical legal autopsy is also done in various post-operative death in hospital to know the exact cause of death when the relatives demands for the postmortem, or they blame the doctors for the death of their patients. In such medical legal cases, in post-operative deaths, we have to do the autopsy. Now, what is meant by pathological autopsy? Pathological autopsy is usually done when there is a sudden death or uh, sudden cardiac arrest of any patient admitted in the hospital, or it may be done in neonatal deaths or suspected genetic disorders or anomalies. Pathological autopsy helps in the to know the exact cause of the death of the patient. When patient dies suddenly due to unknown cause, usually it is advised to do the pathological autopsy. But consent is a very important thing, because consent is required, is must in cases of pathological autopsy. And if usually the relatives don't give the consent for the pathological autopsy, because they are already in this, because they are already the all the uh, circumstances in their family at that time, they usually don't give the consent for the post mortem of their loved ones. So uh, there is another option. We can do minimal or invasive autopsies like biopsy in suspected cases of particular systemic lesions, or when we suspect liver pathology for the death, we can go for liver biopsy, or when we suspect kidney disorder for the death, we can advise kidney biopsy, and like that. Minimal invasive autopsy, it is usually easy for getting the consent from relative for minimal invasive autopsies. Or in some cases we can also advise the partial autopsy. Partial autopsy means, if you say, if we are if we are suspecting CNS lesion, we can ask them for only CNS lesions, and we can get the partial autopsy done of any systemic lesions like CNS, or cardiovascular lesions, or kidney lesions, or abdominal lesions. We can do a partial autopsy. In autopsy, we will do the description of of the findings in gross and microscopic evaluation. In gross, we can we can study the various features, like in CNS we can see for meninges, congestion, brain edema, tonsillar herniation externally, or we can also look for intracranial bleed, or it may be subarachnoid or subdural hemorrhages, or some space occupying lesions in the brain itself. So lastly, we can also do look for kidney, some lesions in the kidney, like एक the corticomedular differentiation, or flea bitten kidney, or the granularity of the kidney. And we can also look for the liver, any evidence of cirrhosis of liver, nodular liver, whatever with the finding is the gross finding, we can take it and we can send them for histopathological examination and do the microscopy and confirm our diagnosis. This is the role of autopsy in pathology. Thank you.